positive cases. There's been 41 deaths in the county. In the Coachella Valley, we've had 401 positive results and 17 deaths in the Coachella Valley. I want to emphasize too, for really, really good information and latest statistics and city breakdowns, if you visit www.rivcoph.org/coronavirus, it's a wealth of information. I believe there might even be a link on the city's website to that as well. I kind of wanted to talk about the timeline as far as when we talk about medical response to this. As we all know, this is an unprecedented event. While we do a lot of emergency planning for earthquakes, for other public health issues, no one anticipated the rapidness of this occurring like it has done. We can debate how long we knew and who reacted when, and I will say I think the county was probably more prepared than many other jurisdictions, because we actually were the first in the country to actually receive one of the flights with the diplomats from Wuhan. So we were able really to learn from that experience about what would be needed as we ramped up our operations. Keep in mind that literally it was only March 7th, which sounds like eons ago, or feels like eons ago, but was not that long when we had our first case in Rancho Mirage, and that was the first case in the county. The next day, the county declared a declaration of emergency, our public health officer, Dr. Cameron Kaiser. At that point too, we talked primarily about the social distancing, no more than 250 people at an event. And as we started canceling more events, we realized that, and as we got more good public health information, and we're looking at empirical examples, especially like South Korea and Taiwan, that really took this on as a public health matter, that's when we really started to ramp up those efforts on our public health side. I'll emphasize here that our reaction to this, while it is a medical one, it primarily started as a public health operation. And there are many, many medical components to that. We originally established first of all, established, a medical operations team. And that was a combination of our public health department, our behavioral health, our medical center, and then our federally qualified health clinics. This was really to begin, how do we start testing? How do we start identifying people that have symptoms? And I'll get into the symptoms in just a moment when I talk about testing sites. As the virus started to grow, especially we in the Coachella Valley, as many of you know, were ground zero for this, primarily Palm Springs and Palm Desert and Rancho Mirage to begin with. As you see by today's number, we see that now moving east. Luckily, the trend in Desert Hot Springs has not been as rapid, so keep up doing what you're doing up there. But then what started happening, and we Supervisor Perez and our team really took kind of a leadership role in how do we really engage our Emergency Operations Center. By this time, as basically about 3 weeks ago, we converted from that medical operations team to a full-blown Emergency Operations Center in Riverside. We decided 3 weeks ago as a team that we would actually start meeting, at least 4 or 5 of us core staff with the supervisor, would run our operations out of the Indio Emergency Operations Center. That just allowed us to have a cohesive message, as well as be in constant communication with our Emergency Operations Center in Riverside. This is not a specific operation in the Coachella Valley. The county's approach to this has been a county-wide team approach, and that is essential that we do that. And I know Linda will probably talk about that coordination and collaboration approach amongst the hospitals when she talks about surging. A little bit about flatten the curve, and I know Linda's going to get into this a little bit, but a lot of our actions that we've done, whether that's the social distancing aspect, the unfortunate closing of businesses down the line, have really been needed to stop the spread. And it's known as this flattening of the curve, because if we don't flatten that curve and we allow the infection rate to go on without all of these measures, our hospitals, our clinics, our ICU beds would become overwhelmed, and we would actually experience more deaths. And I know Linda's going to get into that a little bit more. On the testing side, and I know Dora really wanted me to focus on this a little bit, is since we were ground zero in the beginning, we established the first testing site at the Southwest Church in Indian Wells. I want to give a big credit to Linda and Desert Care Network, excuse me, who, it's just allergies, who really, she played, and the Desert Care Network played a critical role in getting that set up. As it is now, then as well, it was only by appointments. And the reason for that is because at that point was a really limited supply of testing as well as the need to keep our healthcare workers within their healthcare setting, and then of course the limited personal protective equipment. As far as we took appointments for that, and basically you have to have symptoms, and those symptoms are still the same today as they were back then, and that's a dry cough, it's extreme fever, shortness of breath. And so we would go through a questionnaire to determine if people had any of those symptoms. At first we were requiring all three, but then we quickly rapidly changed that to that even if you had one, you can go to our drive-up testing sites now. That operation, extremely successful. It was a great model for the county as a whole on how we expand that throughout the county. We know, and statistics are showing us, and every public health officer will tell you that the better we can treat this virus, or not treat, but identify this virus, is through more testing. And so that's what we really have been focused on as the county. That Indian well site moved to the Indio Fairgrounds back on April 1st, or April 4th, excuse me. And we continue to do testing Tuesday through Saturday at that site. We've actually increased the number of appointment slots, and one day last week, I believe it was Thursday, did almost 400 tests just at that one site. Other testing sites that are happening throughout the county, specifically in Coachella Valley, Eisenhower has been testing from the very beginning. Our federally qualified health clinics, if they have someone that presents themselves with symptoms, will do testing. Additionally, Borrego Health is doing testing as well. And then Desert AIDS Project 2 had set up a triage, COVID-19 triage. That's an amazing operation. They've actually expanded that, and it's not limited just to DAP clients, but to the community as a whole. On the county, we have set up sites in Riverside, Lake Elsinore. We are opening one in Paris tomorrow, and we're actually looking for a site in Moreno Valley. I point this out too because what we've determined as a county, everybody wants us to launch testing sites everywhere, but because of the limited staffing, because of still the limited access to personal protective equipment, PPEs, just the logistics of it all, we really are targeting to where we are noticing hotspots develop. And so that's been the key on how we've identified those. One of those, for example, is we've seen over the last few days a trending increase in the East Valley numbers. And we've been working very closely with the Desert Healthcare District over the last 2 weeks to actually, they have actually allocated money through their board. They're working in conjunction with Borrego Health and Clinicas to set up another East Valley testing operation, primarily for our farm workers and East Valley residents, especially those that have transportation issues, whether even just getting to Indio. So we're continually looking at how we expand this. I think what the new trend is going to be, I don't think, is much like what the Desert Healthcare District is doing, is identifying rapid testing mechanisms so that we can have those results back in as little as 15 minutes. Right now, thank God we've dropped our average, but at one point we were averaging 8 to 10 days to get results back. Then it dropped to about 4 or 5. And again, it depended on the vendor, depended if we were processing those results in our county public health lab, but we are expediting that process. The county additionally is looking at how we would identify more rapid testing so that we can get that out in a wider way. Right now, there is no plan to expand testing to the entire community. Once again, just by the sheer logistical operations that would entail. Ideally, as we get more medical expertise on some testing, if we can get into some antibody community testing, we're more than ready to do that as we move forward. The last thing I wanted to address is the skilled nursing facilities or long-term care facilities. Last week, fortunately, we had a skilled nursing facility, in Riverside that many of their staff were not coming in. And actually one day only one staff member showed up to a patient population of about 80. So the county, luckily, in our preparations, we're ready to step right in, get not only all the staff and patients tested, but we're able to actually relocate many of those individuals. We actually had another facility a couple days later, and again, the county's rapid response. I only bring that up because I know a lot of people have heard stories, and we have a lot of those facilities here in the desert as well, that if you look at Washington State, for example, the majority of their first cases were happening in these skilled nursing facilities and long-term care facilities. What the county has done is over the weekend is developed a strike team, and we are utilizing some of our public health and medical officials to go out to all of our skilled nursing facilities, as well as our long-term care facilities, to train their staff. A lot of what the fear was from the staff is that these aren't full nurses or doctors that operate these. These are, they don't have the advanced medical experience in order to deal with this. So there was a big fear factor. So what we believe is that as we can go out and train people on how to isolate people, how to identify symptoms, how to get people linked to testing, and then also providing them their own personal protective equipment to give them that extra level of safety. So we're taking a very proactive approach because we could see this as developing as a hotspot and want to make sure that doesn't happen. I'm going to leave it at there, and again, I'm open to any questions you're going to have on the medical side. I just would like to reassure those that are on the call that this county really started addressing this from the very beginning. Again, our whole focus on this, on every order that has come down through the public health director, on everything that we're doing as a county and community and cities together, is because this is a medical reason to address this. So thank you for the opportunity. Appreciate it.
Greg, I really appreciate it, and thank you. The county's been a good partner with us, and we're trying to do our part here in Desert Hot Springs, so the more information we can get out, the best. I will address one thing. The Borrego has 3 locations here in Desert Hot Springs, and the one that you would want to go to get tested would be the Pearson site across from the Catholic Church. That is full services there, and they would be the one to test you. Linda, thank you for joining us, and what would you like to add? Well, I see her name there, but I think we're having some technical difficulties. So we do have some questions coming up. Doria, if you want to read the question, maybe Greg can answer those while we get those issues worked out with Linda's phone or recording.
So the question that I'm seeing here is, has anyone tested whether this can be transmitted through mosquito bites or blood-to-blood transfers?
As far as the data that I've read and heard is no, through either one. It's primarily, it's basically a mucus transfer. So, just tiny droplets. So no blood and no animal.
And if you are on the line and you want to ask a question, if you go to the bottom of your screen, there's a Q&A button. You can press that and type in your question. We'll get those answered for you. Greg, you said go ahead.
I'm sorry, there's another question. And this was actually sent to me through a message. So the question is, or it's a statement at first, so we're telling people to wait at home rather than admit them to the hospital when they're positive as a method to prevent overwhelming hospitals. There's people questioning hospitals being empty while people are sitting at home with COVID. Will the policy be changed?
So a great question. The short answer, no, not right now. What we do is when we test, and this is for any organizations that are testing, whether it's the county, the drive-up sites, DAP, Borrego, if somebody presents with symptoms and comes and get tested, they're given direction to go home, isolate themselves until those results come back. If they come back positive, then we basically, in conjunction with their primary care provider, are determining what their level of illness is. So if they can ride this out at home, it's far better for them to do that. And I know Linda's going to speak to this in just a moment. I talked about the flattening of the curve a little bit ago, and a lot of that all of it has to do with hospital capacity, hospital bed capacity, ICU bed capacity. And even though we may have empty beds in the hospital right now, we don't know, or especially didn't know 2 weeks ago, what type of surge we would have. And so it's really essential that if we had a big surge in critically ill people, that we needed to protect that bed space. And we've not only protected the bed space that we've had, but Linda can probably talk to the amount of new beds that have been created within the individual hospital institutions.
So we got you now, Linda?
I think so. Can you hear and see me at this point?
Yeah, you're a little further out there, but we'll try to get your volume up.
Hold on. I can change that a little bit. Let's see.
Oh, that's much better.
Better? Okay. So the challenge is when you're in a hospital, there's a lot of firewalls on your personal devices, and yeah, we'll get there.
So again, thank you for joining us.
appreciate the opportunity, and Greg and I have spent a lot of time on various calls and Zoom meetings. I'll just say from the standpoint of being balanced and working in the hospital administration and being mayor of a city, I don't want to make light of it, but there's that community perception of it doesn't seem like it's that bad compared to what the reports or the panic or the fear seem to be. And yet we're balancing that anticipated surge in a hospital capacity and looking at how many beds we can convert to negative isolation rooms, how many ICU beds, what kind of staffing do we have enough ventilators? And then I'm balancing that with the why can't we play golf on our private country club golf course? So, I get both sides, and I think it's really important that when the emails that I received over the weekend, this past weekend, have been what's going on with the county statistics. We were supposed to have 1,000 deaths by now. We only have 41 deaths in the county, which, thank the Lord, right? We've got to celebrate the fact that there is something to be said, and I want to thank everybody that's out there listening, that flattening of the curve, the washing of the hands, the masking of the face, the staying at home, only having essential runs, that truly is making a difference, because we saw what happens in other parts of the country when that didn't take effect as quickly as it did in Riverside County. And we seem to be a little bit more aggressive than other parts of the state, but it seems to be paying off. And first it was over the weekend, and now it's supposed to be tomorrow, that all of the ICU beds and all of the hospitals here in the Coachella Valley are supposed to be at capacity. The good news is they're not, but that flattening of the curve has somewhat elongated the curve based on even state projections and what Governor Newsom stated in his press conference, that while it's lower than projected in terms of the mass amounts of people that are ending up in a hospital on ventilators, it's going to take a little longer to come out of it. This whole let's just stay still for 2 or 4 weeks isn't quite going to make coronavirus go away. I'll say as of this morning, we've had in Desert Regional 11 positive patients and 11 PUIs. Those are they're patients under investigation, meaning that we're waiting for those results. Eisenhower currently has 17 positive patients with 23 PUIs, and JFK's got 10 positive patients with 2 PUIs. Those numbers used to be very skewed in the previous weeks, and that had a large part to do with the testing and how long it took us all to get test results back. So we had patients literally in our hospitals for a week at a time in a under investigation mode, which means you have to gear up with all of the personal protective equipment, the PPE, with every encounter with those patients. And imagine when you're in a hospital, what happens when you're laying in that bed. You're seeing your nurses, you're seeing your doctor, you're seeing your specialist, you're seeing dietary, you're seeing housekeeping, you're seeing the radiology person, you're seeing the lab person, and all of those individuals are what we call burning PPE until we know if that patient's positive or not. And the majority of those patients ended up, knock on wood, being negative. So while we're not at capacity, we still have a number of patients in all of the hospitals that may be being treated for COVID, but they're not in the ICU status. They're not on a ventilator per se. But we are still planning and acting and staffing as if we're still going to hit that surge. And the best case scenario is that we don't, and then people think we over-exaggerated this as a county, as a Coachella Valley, but that's the best thing that could happen for the health and the safety of all of our residents. When you look at how the cities and mostly how the hospitals have planned, there's been those phases, and Greg talked a little bit about that phasing. Phase 1 was when that plane landed on March Air Force Base with that initial outbreak, and how we had to gear up with that and look at the travel ban and the screening process for anybody who traveled. We then quickly moved into phase 2, which is 1 to 3 weeks later, when we suddenly realized that our first patient was community spread, and we couldn't trace it back to a specific travel or cruise ship surge. And that's when things like elective surgery started being canceled, and we started converting rooms to negative pressure. And that is making sure the air that is in that patient's room can only be breathed by that patient and it is expelled, so that it's not through the entire air conditioning system like a cruise ship, like a hotel, like your house. You have to maneuver them mechanically and get them approved by licensing so that they can be contained for that patient's environment, so it's safe for everybody around them. Why the cancellation of elective surgeries? Greg talked about hospitals being empty, and yet we're gearing up for all of this demand. When you do certain surgeries that may require personal protective equipment that's better served for those patients in ICU and those caregivers taking care of them, then you delay those elective surgeries. Eisenhower was the first to start canceling theirs. Desert went on a few weeks later, canceling theirs and putting off those. If there's emergent things, of course. If there's heart attacks, strokes, all of those things are still operational. But a lot of the normal hospital functioning has been kind of put on hold to a certain degree. And if there's not necessary areas of the hospital that need to be functioning because we need those resources of staff, physicians, supplies, it's all been rerouted to the COVID areas. You know, the community spread continues at that point. We started doing telehealth, virtual meetings, and all the surge planning. Phase 3 is where we started seeing a lot of that PUI, a lot of the suspected cases. Why? Because of the testing Greg talked about. It was very fascinating to team up with Riverside University Health System and the county. Borrego stepped in for a few days as well, and we were out doing these drive-through testings. And some of these people were very, very sick. And I think that was kind of the misnomer, is we didn't have that many cases because we weren't testing enough people fast enough to get results to show that we have a lot of positives roaming around. You and I could be positive right now, Scott, and we may not even know it. And that's because we're asymptomatic. We might be carriers, hence the face mask, the washing the hands, the distancing. Those things are all very relevant. I believe the last projections by Dr. Kaiser were that could be upwards of 20,000 residents in the Riverside County could be positive. That doesn't mean that they're going to end up intubated on a ventilator in the ICU at any one of our facilities. It's not the case. It's similar to the flu. It hits people a different way, and obviously the compromised will get hit harder, but many of us may fare through this and not even realize it. It's about how they're spreading it potentially to others who could get more impacted. We're kind of at the phase 3 and going into phase 4, which is that surge planning. What the hospitals have done is they have converted their normal units, med-surg, telemetry, ICU, into almost like COVID cohorts. So they're keeping in one floor or one pod all of those patients together with that staff, because you can help contain and maintain that care plan a little bit better. And then you still have that uncontaminated area, so to speak, in the other parts of the hospital for clean patients. Although we're very proactive. For example, in emergency rooms now, the protocol is, we used to have the CDC guidelines where one line was viral and one line was non-viral. Your symptoms or not symptoms, you're here for, you think it's COVID or we're not. Now, the entire emergency room departments are wearing N95 masks, because we found just recently that even a patient coming in with a stroke or a heart attack, completely non-symptomatic from a COVID standpoint, that after you treat that problem and then they get into the hospital, they end up testing positive. So we've just got to be protective of all of that on any given time. When you get into our severe surge, that's when you're looking at taking over the entire hospital with nothing but COVID patients. And again, knock on wood, that has not been the case. We are planning as if it will. Again, it's supposed to happen now. You would keep pushing back that date, and it sounds like we're never going to get there, and I'm okay if we don't, but we have to be ready, because other parts of the country haven't even gone where we've gone yet, and we don't know exactly how long this is going to last. So I guess one of the important things is when you look at ICU beds within the Valley or a hospital license, you have X amount that are on a license. And early reports were, oh, well, the Valley only has 81 collective ICU beds between JFK, Eisenhower, and Desert Regional. Well, we can ramp those up significantly by having the equipment available, the staffing available, and the resources available. And that's what all of the hospitals have done. I'll give you an example of surge planning in the Desert Care Network in terms of bed capacity. We can go from licensed beds at Desert from 385 up to a super severe surge capacity of 679. JFK can go from 145 up to 189, and Eisenhower, which is in the 500 range, can go up to 700 or so. How do we do this? Because we're consuming areas like the lobbies, the waiting rooms, the tents that are outside by emergency room departments, some of our outpatient areas. You can convert those into patient care areas in the event a major surge occurs. Planning that way, expecting to have resources for that, continuing to have personal protective equipment, ventilators, and staffing, but hopefully it is showing that we are making progress, and I can't give enough credit to the community that's been out there doing their part to help, because it has helped, and we hope that it continues. Just today, mentioning out of all of the Riverside County, there's 38 positive here in the Coachella Valley and 36 under investigation, and 51 of those patients of the 196 countywide are on ventilators. So we've got a lot of patients we're caring for that are not on ventilators. And that 38 positive is based on 232 countywide that's positive as of yesterday's report. So we're tracking these on collective calls. We're submitting reports similar to what cities have to do during disaster drills, and we have live process, and we're reporting things through our Emergency Operations Center. Hospitals are doing the same thing. They're submitting staffing requests, supply requests, equipment requests through the county, and that's where the state pool comes in. I do want to share something about the news story last week where it said that Governor Newsom shipped out 500 ventilators elsewhere when Riverside County had requested them and were denied. Those things are true. However, FEMA is the one controlling those items, and they are going to divert them to where you need them most. And that would mean in the event we do hit that surge, they are going to come back to us. I can say our parent company had to, quote, donate, not from the Coachella Valley, not our hospital, but from elsewhere company, some of those ventilators. And the term is you donate them or the state and FEMA do not bring them back to you. So I have felt comfortable that while we've had some areas that are a concern from a supply and equipment standpoint, those needs are being met collectively, either through our national organization, through the county collaboration, and or the state ask. And we haven't been completely depleted of anything. We are following the CDC guidelines and the conservation protocols for some of these items. And I guess the big message is for those patients that may be positive that are told to stay home and quarantine, unless there's severe difficulty breathing and your fever gets so high that you feel like you need to go to the emergency room, that's the waiting out period. And your contribution is that if you're not so sick that you need to be in a hospital, staying at home and not passing that on to somebody else completely helps the entire cause of this curve being flattened even further and this thing getting through and getting by us. I guess I'll stop there if there's questions.
Yeah, we do have some questions. I did, before I have Doria read this question, I think Greg will need to answer this, but I have, the question I get the most as mayor is what makes this different than the regular flu? More people die of the flu than this. Why is this pandemic different? How do you answer that?
Yeah, a couple of things actually. So a flu basically, the catchiness, I'm not getting the right word, but basically you transmit basically one-to-one person. This one, what we found is that the transmission can be 4 people, 3 people. It's not clear data, and Linda may step in here with better data than I am, but that's one element of it. The second two is the actual death rate of this is higher than what your normal flu would be. And so that's been the concern about this as well. So again, to Linda's point, and again, it's a new virus. So as we go through this and we learn more about the virus, it could be even worse than we know. I think Linda makes a great point that we really believe, in public health and medical experts believe, that there are many people that have this virus, but one are asymptomatic and, you know, could transfer it on. I think that's been the fear, is we didn't know, especially with those as well.
Yeah, if I could just add to that in terms of the difference. I've talked to our infectious disease specialists. I'm not clinical in training by any means. I've just been in healthcare many years. And the most frustrating part for them is they are skilled to treat a disease or a situation or an incident based on what their expertise is and their knowledge and how to do that. There isn't a cure right now, so they can get certain patients to a certain point, and quite honestly, they feel helpless because they can't get to that next step. And if you heard Dr. Mike Masitska, who's the head of the EOC at Riverside County, emergency room physician, he will tell you that the difference between pneumonia, the flu that turns into pneumonia, it's almost as if the lungs, this virus gets into the lungs so much so that even pushing oxygen into those lungs, it resists accepting that. It's almost like it blocks it, like your filter is full and there's no more circulation of air, and your lungs react that way, and that's what begins shutting down everything else in your body. That's the difference of not being able to shake that piece of what would be your pneumonia or the flu. And because of the way it spread much quicker and much faster than what the flu is. But I will agree that I, for one, have said, look at how many people die from the flu every single year, and we have not decimated our economy over it. Not even H1N1, not even SARS. More people died of that years ago than we are seeing right now, but we don't know what else is going to happen with coronavirus.
Doria, you have a couple questions up there. Why don't you read them?
All right. right, so actually this goes really well with Linda's last statement. So what date will the county allow people to go back to work and non-essential businesses to open again? People can't go much longer or they will be totally destitute.
And totally understand. That's the question we ask every day in our office. And the honest answer is we don't know at this point. What we are encouraged about is some of the modeling that we're seeing. We talked a little bit before about the numbers that we were expecting to be at today that we're not at. And a lot of that is based on modeling. I think everybody's heard federal modeling and state modeling and local modeling, but it's critically important to have that modeling. As we go forward, and if we are being as effective as we are right now in flattening that curve, then, and we are already having these discussions, is, when is that time going to be, and what does that look like? Soft openings, to Linda's point, maybe we do get to self-isolation on golf courses. And, we saw the drive-through or, parking lot church ordinance last week, and now that was only for Easter Sunday. But as we move forward, what I'm getting at is how do we look at options on how we get going again? Even down the road in just a little bit, hopefully, even restaurants opening back up. But again, social distancing through tables and stuff like that. These are conversations, and some of you may have seen the supervisor's one of his Facebook posts last week, but I get back to the point, we've really only been dealing this full steam ahead for about a month and 5 days. And a lot of that had to be the public health aspect. How do we prevent people from getting sick? How do we make sure our hospitals don't get overwhelmed? But as he said last week, is we now are starting those discussions. How do we not only start reopening our economy, but more importantly, how are we looking at ways to stimulate that economy moving forward? And that's even long-term approaches. And we're working with people like Scott White at the Convention and Visitors Bureau. We're working with folks from CVEP. We're working, with the Greater Coachella Valley Chamber of Commerce to look at even new ways of industry and new ways of attracting business so that we lessen that economic impact. We get the economic impact of this, trust me. My own family has lost jobs, my son, my partner. We hear the stories every day. And if you just literally sit and think about the number of people that are not working, whether that's Uber drivers and bus boys and, outside of restaurant industry, just your ancillary services, we get the impact. And again, I will be honest with you, I don't have a set date, but we are constantly looking at those models, and we'll do it as soon as we can, but in the most careful way that we can so we don't see a resurgence.
And from a mayor standpoint, maybe Linda can chime in on this, we want to get our businesses back open as quick as possible. We rely on those tax dollars to roll in to keep your city moving forward. Our city council was working last week on the fact that we're looking at budget cuts now to compensate for the first and second quarter of next year when we don't receive those tax revenues, or people had to utilize the governor's order and not pay those taxes for whatever the order was, 6 months to a year. So we as cities have to do that. So we want to get you back to work as quick as possible, but we're also being good stewards and following the county, state, and federal orders to make sure that we help flatten that curve.
And if I could add to that, I completely agree with both Greg and Mayor Mattis's comments. And when you look at, even La Quinta is looking at $7.5 million in revenue from TOT and sales tax projections with just this short period of downtime. And we know we're a tourist-driven economy here in the Coachella Valley. But I also see on the flip side then, okay, what happens if there's an outbreak? If we can't get testing to show who's built up the antibody, or we can't get the vaccine before next flu season, do we have another? I don't support keeping everything closed, because we then have to look at the recovery plan of substance abuse, mental health needs, domestic violence. We're already starting to see an uptick of some of that in our law enforcement areas, of the calls that they're getting. And I think we've got to find new ways and list those orders calculated and in a safe and healthy manner, because I've seen new travel restrictions. When this thing first broke and tennis was canceled and there was 10 people allowed in a restaurant, I went to pick up food at my favorite little Mexican joint in La Quinta, and there was a family from Kansas City, Missouri that was here and planned their whole week around tennis. They decided to stay, and they wanted to see what else was around, but they also said when they returned to Kansas City, they were going to be on a 14-day quarantine because California was considered a high-risk state to travel because of COVID. So that's something as policymakers we could start looking at proactively is how are we going to, if we enforce or encourage lifting of some of these orders as the opportunity presents itself in a calculated but health conscious manner, how do we still say social distancing is important? The masks outside are important while we have some non-essentials or restaurants or other things start moving back into the employment realm. Because there isn't a date right now and that seems to be getting pushed back. But I also don't want to see that we hit a peak, we hit surge, and we lose more lives. Perception of people thinking, okay, now we're through this, let's go back to school, let's go back to work. There's so many unknowns, and it's very, very frustrating, both on the mayor side and on the healthcare side.
We have we have about 20 minutes, so I'm going to have Dory ask one, start answering, get those questions answered, and then we'll give you each a couple minutes to wrap up.
Okay, so another question that we have, is there more than one strain of this virus circulating? And if so, would it be possible for a vaccine to be developed against all of those strains?
I'm not aware of any, you know, people are the brightest minds in the world right now are fiercely working on vaccines. Linda, I don't know if I haven't heard of any other strain at all.
No, I haven't heard the doctors talk about that either. I think that the important thing is definitely building a vaccine. Yeah, I would leave that to the experts, CDC and Rivco PH on the websites for any updates on that, but we have not heard of that.
Yeah, and I would have heard of that from our public health and our medical teams. So.
Okay, so next question, what will the availability be for a test of having the antibodies of the virus? If we identify immunity, those persons could be returned to work, presumably.
Yeah, great question. And that's a lot of the discussion that's going on right now. And I mentioned that a little bit earlier is identifying what those antibody tests are. More importantly, how do we get a hold of them? It's just like the personal protective equipment. And I'll tell you, the county has a logistics in our emergency operations center that's doing all of this daily basis is trying to find the PPEs, trying to identify suppliers and manufacturers of this rapid testing. And they are coming online. We keep in mind, it's, again, to Linda's point, is these companies as well are looking at where are the greatest needs right now and hotspots. And we would argue in Riverside County, because we've kind of led the effort on a lot of our initiatives outside of the governor and the Bay Area, there is, we're advocating for those in this area too. As I mentioned, Desert Healthcare District is working with Clinicas and Borrego to start doing some of that community testing. It will be symptomatic at first, but as we get those logistics up and running, then we can hopefully expand, because that's a great question. And the medical experts say if we can do that in an effective basis, then that is the way to kind of start opening things back up again.
And if I can add to that, one of the differences we've done here at Desert Care Network, specifically Desert Regional, we now have the certified lab equipment, the Luminex machine that will be able to produce a massive amount of test results in a shorter 2-hour time frame. We removed an old piece of equipment from actually High Desert Medical Center, had it redone, so it also meets some qualifications. And we have the Abbott ID Now, which is the rapid point of care testing. However, you know, it was referenced on a call this morning. It's great that we have this really nice paperweight of a machine, but we need the reagents. So it's almost like they gave you an engine, but they didn't give you the oil. So some of the challenges is making sure we have the equipment that's allowable by the county health standards and the state health standards to be able to do these test processing, because LabCorp and Quest are the two outpatient labs that are certified to produce and do the test kits in-house in the hospitals. We've ramped that up, so our turnarounds are a lot quicker, but it's a challenge now, like N95 masks or isolation gowns. It's getting reagents for this Abbott equipment to be able to do those tests within just a few minutes. It'll be a game changer.
Okay. Next question. Can the city open businesses again, even if the state says to stay closed longer?
So we take a lot of our direction from the state and the governor's orders. We have gone a little farther. A lot of the governors are recommendations or suggested actions to take. Our public health officer, you know, with his team, then determines where we want to go on that. But a county public health order is a directive for the entire county, and that includes cities.
Are there any other questions? I'm not showing, oh, I have one more that actually was messaged to me. I've heard multiple instances of people getting very ill with COVID, but denied getting a test. Why so little willingness to test people that believe they have it?
That is not the case in Riverside County at all. I know there have been stories about that. I think it's very important to keep in mind whatever issue we deal with, whether it's an illness or anything, there's always the conspiracy theories. And I can guarantee you that, and as I said, Riverside County really took a lead. In a lot of jurisdictions, we're only testing if you were, had, you know, all 3 major symptoms or 2. We decided even if 1, just for the sake of being as cautious as we could and flattening that curve as much as we could, we do that testing.
Well, and I'll tell you, let's just repeat the number, 1-800-945-6171. That's the 800 number to make an appointment for the drive-through testing that's now at Indio Fairgrounds. And I'll say, working on those lines for the last couple of weeks or so, I will say that people would drive up even though they didn't have an appointment, but if either they were exposed to somebody positive, if they had a fever, if they just, you know, were sent home from work because they didn't feel well and they just wanted to be self-assured. At that point in time, we were only getting about 150, 200 test kits per day. We're getting a lot more now, which is great. We would not turn people away because it's better for them to know. But again, most people, if they're not symptomatic, they would show up as negative today, but tomorrow they can have a fever, be tested again, and be positive. So when there was an allocation, we didn't want to waste the test on people that weren't truly very sick with a multiple either travel, fever, shortness of breath, cough, that sort of thing. But the drive-through has been really extremely helpful from a peace of mind for some folks. We've also seen a number of healthcare workers go through the drive-through because if they were in a situation where a patient had come through, say, a skilled nursing facility and they weren't identified as positive and then later they were, you have to do a look back to every place that patient went. Same thing with a hospital. Somebody entered the hospital with an appendicitis and then eventually after surgery, for some reason they started spiking a fever and you tested them and they were positive. You have to go all the way back to the ER and everybody that might have encountered that patient and check their symptoms as well. So we are very much being proactive on the testing now that we have the access to that, because the more we know, the better our modeling and our statistics can be on what to anticipate.
Okay.
One more question. Go ahead.
Is this the one you were talking? Okay.
Yep.
Orange County just had drive-through testing for anyone that wanted to pay $75 to get an instant test. It was a 5-hour-long line, but at least people could get tested. Will county or hospitals here do the same?
So I was sent a picture over text on some site that popped up in the desert here that were charging $127. We're researching what that site is right now. There's no plans for the county to do that. We do not charge for the test, nor do I think anybody should really be charging for a test, especially in our community, that a lot of lower income individuals. So I can make a joke that, well, that's Orange County, and I can say that because that's where I'm from, but we haven't seen that, and the county's not planning on doing that. We are checking. I did email the message I got to our public health officer so that we can look into this, because it may be legitimate, but I want to make sure that people aren't being charged for the sake of somebody making money off of this.
Greg, Linda, is there actually an instant test, meaning you can get tested and know right there?
15 minutes. There's a 15-minute turnaround test, yes. It's just a matter of making sure we have ample supplies. Again, it's the engine without the oil, so you've got to have both together to be able to turn it. And it's a finger prick, similar to like a sugar or cholesterol.
Well, the biggest thing, and you'll know this, guys, is that you're combating rumors all the time. So recently, there was a big rumor going around at a big box store that a family member works at, that an employee got pulled over because they weren't wearing their mask. And so we know that most law enforcement are not doing that right now. So I said, you need to double check that. But they got everybody panicking to go get a mask, which I think was what they were trying to accomplish, which was good. But for the most part, we know that there's so many rumors out there, and trying to combat those is always a tough thing.
Yeah, and that's been our most challenging thing, is not just the rumors, but additionally is getting out the information. I think we're a little luckier here in the Valley because we have our own media market, and our media has been very good about this. We already coordinate on so much stuff, as you, Scott, and Linda know, whether it's transportation, environmental stuff, through CVAG organizations or Visitors Bureau. So I think we're a lot better on that. But, we even heard a rumor on Friday that, Palm Springs police were driving around stopping people and asking if they were essential workers or not. And it's just the farthest thing from the truth. So that is hard to combat.
So we're running out of time here. I have no more questions, but I want to get you each some time to wrap up here. We try to keep this under an hour, and I know I have to move on to another meeting. Just meeting after meeting, it seems like. And try to balance our mayor life with our work life, with our personal life is always tough. But the more information we get out there for our residents, helping to keep us safe, let alone keep the rest of the Valley safe, since we have a lot of workers out there that leave our community every day to work in all the other neighborhoods and county areas or across the Valley. I think I believe our residents have done a great job, and this information, even though we only have 13 people watching today, will go out live or be back on YouTube and rerun on our Spectrum Channel 17 and our Facebook page, and hopefully get a lot of information out there and stop those rumors. But if you guys could take 5 minutes and wrap up anything that you feel is important, I appreciate it.
Sure. I want to go back to one thing that Linda said about specifically childhood and domestic abuse. We've seen reports of those numbers going down. It is important for people to remember that since children especially are not seeing teachers, therapists, psychologists, just regular people that interact with children on a daily basis, we know it's still happening. It's just not being reported. So we encourage you, if you notice or see any of that, to make sure that's known as well. Also, Linda brought up the tennis cancellation, which was the first major cancellation, and talk about a stressful time. But I tell people, can you imagine how bad this would be if we have had all those large scale events in this desert? The number of people that come from throughout the world for all of them. So it was the right move. Did it hurt us economically? Yes. This thing couldn't have happened at a worse time in our Valley for tourism, like Linda said. I'll also close on, I encourage people to not only visit the rivcoph.org/coronavirus, but also the supervisor's website, rivco4.org. We have a lot of information on that site, specifically to testing sites that you can pull down the numbers. Linda did give the one for the county testing, but Borrego's numbers on there, Eisenhower's numbers on there. We also have templates for letters for renters that need to identify their landlords if they're not able to make the rent due to the COVID virus. So I encourage your listeners to go there. I'll just close, and really again, Mayor and Dory, I want to thank you so much for holding this. To your point, Scott, and this is what we try and do as much as we can out of our office, is get as much information out there as possible. We want to make sure that the public has the most accurate information, and it's opportunities like this that allows us to do that. So thank you so much.
Absolutely. Thank you, Greg, for joining us. Linda?
I would just like to say that please recognize that while there's still a detriment to the economy and that we're all anxious to get back into the employment realm, the school realm, and what we call normal life out here in the Coachella Valley, think about those families and the healthcare workers, the people in this building around me. I'm at Desert Regional right now, the first responders that every day they're taking care of patients that have an incurable illness that is highly contagious. And while we are all taking every precaution for the safety of those healthcare workers, if there is an uncontrollable spread, you get exposed. We have healthcare people that are on quarantine for 14 days if they start not feeling good. We've had police officers, we've had firefighters that have gone into homes to do their job and end up being on quarantine. That deplenishes the resources in our health force. So thank those first responders. Recognize that our healthcare workers are the heroes, and they want you all to stay at home and help flatten the curve so that we all can get through this, because it helps them and the families that they're with. Some of them aren't even staying with their families right now because they don't want to bring that into their home with their children, or if their parents are living with them as well. They may be fine, but they could be the carrier again. So it is something that's very real inside the walls of a hospital that seems a little less real when you're standing in line at Costco, but it's out there, and we just have to collectively try to be patient, be cooperative. I just commend everybody for doing the orders appropriately and wearing the mask and washing your hands. I want to get through it as quickly as the rest of us do, but I also recognize that we still need to collaborate like we have been. One city can't pull the trigger and saying we're opening everything back up and the rest of them don't, because it will not help the overall situation for our entire community. So thank you. And thank you for the opportunity for allowing me to speak.
I really do appreciate that. Pamela had another question, but we're not going to have time to answer it. Pamela, if you can send Doria Wilms an email, it's D as in Doria and her last name on the screen there, WILMS at cityofdhs.org. She'll get you an answer for that. I appreciate the staff members. I appreciate both the panelists today. More information we can get to our residents is all we're trying to do here to make sure that the rumors stop and that they get as much information as they can. We'll get through this together, and as the county says, stay in place, maintain your space, and cover your face, and we'll get through this. Thank you, everybody.
Thank you.
Thank you.